Hi, my name is Maeve Connolly. I'm the Irish representative on the board of the Glut1 Deficiency UK charity. I'm here to introduce you to Glut1 Deficiency. Glut1 Deficiency is a rare genetic disorder that impairs brain metabolism. Glucose isn't properly transported into the brain, leaving it starving for the metabolic fuel it needs to grow, develop, and function normally, and causing a wide range of neurological symptoms. The number of people currently diagnosed with Glut1 deficiency is thought to number in the hundreds. Recent studies, however, have estimated true prevalence to be at least 1 in 24,000, so the vast majority remain undiagnosed. Glut1 deficiency is caused by mutations in the SLC2A1 gene, which regulates production and activity of the glucose transporter protein type 1, or GLUT1. Since it is an autosomal dominant disorder, just one mutation in one of the two copies of the gene is enough to cause the disease. Glut1 is the only transport protein that moves glucose across the blood-brain barrier, where the brain uses it as the main source of energy. Without enough glucose, brain growth and function are impaired, resulting in symptoms that can vary widely between individuals and may change over time as a patient ages. Puberty often brings changes in symptoms and treatment response. Symptoms may be present all the time, occur as temporary episodes, and may fluctuate in severity. Not all patients experience all symptoms, especially in milder cases. The range of symptoms may vary from mild to severe, sometimes making Glut1 deficiency difficult to diagnose. Most people with Glut1 deficiency have some form of complex movement disorder that may include one or more of the types listed here. Movement disorders tend to become the dominant feature in adolescence and adulthood, and new types of movement episode may appear. Dyskinesia is a category of movement disorders that are characterized by involuntary muscle movements. Paroxysmal exercise-induced dyskinesia, or PED, is induced by prolonged physical exercise or physical exertion. The patient in this video started to exhibit signs of PED during puberty at age 14. He has been seizure-free since age 5 when he was diagnosed with Glut1 deficiency and started the ketogenic diet. Seizures are common but not always present, and multiple types of seizures may occur with both focal and generalized onset. Typically, seizures begin in infancy or early childhood and tend to stabilize, decline, and sometimes eventually resolve beyond puberty and into adulthood. Most seizures in Glut1 deficiency are not easily treated with medication. Most patients experience some degree of cognitive impairment, ranging from subtle learning difficulties to severe intellectual disabilities. While there are individual differences, some general patterns that impact learning and performance are found in patients across all ages. When planning instruction and interventions, it is important to build upon strengths as weaknesses are remediated. In adulthood, the extent of cognitive and medical challenges experienced by each individual can impact various aspects of their lives, including the level of independence patients can attain, the types of volunteer and vocational opportunities available to them, and the services and supports that they may be eligible to receive. Behavioural symptoms affect relations with other people and may include short attention span, obstinance, and delays in achieving age-appropriate behaviours. Some patients have been additionally diagnosed with attention deficit and/or autism spectrum disorders. Anxiety, obsessive-compulsive tendencies, mood disorders, and behavioural outbursts are also reported. Sociability, however, is often reported as a strength in many patients with Glut1 deficiency. Global developmental delays are typical for Glut1 deficiency patients due to the many symptoms experienced. Young patients may reach developmental milestones such as walking, speaking, and toilet training at a delayed rate. Fine motor and visual motor skills may be affected, including writing. Gross motor delays may affect core body strength, balance, and coordination, and speech delays may affect articulation of expressive language. Additional symptoms are listed here. Symptoms can be triggered or worsened by excessive exercise, illness, hunger, weather and temperature changes, hormones, fatigue, anxiety, excitement, and other strong emotional reactions. When Glut1 deficiency is suspected, glucose should be measured in the spinal fluid and in the blood simultaneously after a 4 to 6 hour fast. Fasting CSF glucose below 3 millimoles per litre and fasting CSF to blood glucose ratios below 60% signal Glut1 deficiency. Genetic testing can also help confirm diagnosis by detecting mutated SLC2A1 gene, although current testing does not identify the mutation in up to 15% of cases. The combination of suggested clinical symptoms and the characteristic CSF findings indicate Glut1 deficiency diagnosis, even in the absence of an identified SLC2A1 mutation. There is currently no cure for Glut1 deficiency. The recommended standard of care treatment is a medically supervised ketogenic diet, which can improve most symptoms for most patients, even in adulthood. A ketogenic diet is a high-fat, moderate protein, low carbohydrate diet that provides alternative fuel to the brain with ketones instead of glucose. The earlier the diet is implemented, the better the outcome for patients in improving seizure control, movement disorders, and cognitive abilities. Occupational therapy, physiotherapy, and speech and language therapy are often recommended supporting optimal development in children and remain beneficial into adulthood. We at Glut1 Deficiency UK, in consultation with our Medical Advisory Board, have produced an information leaflet on Glut1 deficiency. The Glut1 Deficiency Foundation in the US has an extensive library of resources which is backed up by medical and science professionals on their medical and scientific advisory boards. We at Glut1 Deficiency UK are very grateful for their ongoing support. Thank you for your interest. Please feel free to contact us.